Are you experiencing frequent fractures or unusual pain after minor falls? These could be signs of an underlying issue that's weakening your bones. Let's uncover what your body might be trying to tell you and how you can take action before it's too late. Frequent fractures are more than just inconvenient. They're often a sign that your bone health is compromised. When bones fracture from minor falls, bumps, or even daily activities, it's a red flag for conditions like osteoporosis or osteopenia, where bones lose density and become brittle. Unfortunately, these issues can remain silent for years until a significant injury occurs. One of the biggest challenges is recognizing that fractures, especially in older adults, are rarely just accidental. The wrists, hips, and spine are common fracture sites, and each injury can significantly impact mobility and quality of life. For example, a hip fracture in older individuals often leads to long-term disability, with many unable to regain full independence. What causes this fragility? Age is a primary factor. As we grow older, our bones naturally lose density, particularly after the age of 50. For women, menopause is a pivotal period because the drop in estrogen levels accelerates bone loss. Other underlying conditions, like chronic illnesses, vitamin D deficiency, or hormonal imbalances, can quietly contribute to bone weakening without immediate symptoms. Medications also play a role. Long-term use of corticosteroids or certain anti-inflammatory drugs can thin your bones over time. Similarly, lifestyle factors, such as a lack of weight-bearing exercise, poor nutrition, and smoking, can further weaken your skeletal structure. Understanding the warning signs beyond fractures is crucial. Persistent back pain, a stooped posture, or a loss of height may indicate small, undiagnosed fractures in the spine, known as compression fractures. These are particularly dangerous because they can worsen over time if left untreated. Taking action early is key to preventing further damage. Pay close attention to your body's signals, especially if you've experienced more than one fracture recently. Seeking professional evaluation, including a bone density test, can help identify the root cause of your bone fragility and guide effective treatment. Bone fragility doesn't happen overnight. It's often the result of multiple risk factors that work together to weaken the bones over time. Recognizing these factors can help you take control of your bone health and prevent serious complications, like fractures. One of the most significant risk factors is age. Bone density peaks around the age of 30, and after that, it gradually declines. This natural process is accelerated in postmenopausal women due to the sharp drop in estrogen, a hormone essential for maintaining bone strength. Men, too, experience bone loss as they age, but it usually happens at a slower rate. Family history also plays a critical role. If your parents or close relatives suffered from osteoporosis or experienced fractures after minor falls, your risk of developing weak bones is significantly higher. Genetics can influence bone density, size, and strength, all of which impact your susceptibility to fractures. Lifestyle factors are another major contributor. Diets low in calcium and vitamin D deprive the body of the essential nutrients needed for bone formation and maintenance. Additionally, physical inactivity, particularly the lack of weight-bearing exercises like walking, jogging, or strength training, can lead to weaker bones over time. Smoking and excessive alcohol consumption further worsen the situation by interfering with the body's ability to absorb nutrients and maintain healthy bone tissue. Certain medical conditions can also lead to bone fragility. Chronic illnesses such as rheumatoid arthritis, celiac disease, or kidney disease can directly or indirectly weaken bones. Hormonal disorders, including hyperthyroidism or low testosterone levels, are known to negatively affect bone health as well. Lastly, long-term use of certain medications, such as corticosteroids, can have a detrimental effect on bone density. While these drugs are often essential for managing chronic conditions, their impact on bone health requires close monitoring by healthcare providers. It's important to remember that risk factors often overlap. For example, an older individual with a family history of osteoporosis and poor dietary habits may be at a much greater risk than someone with just one of these factors. Understanding your unique risk profile is the first step toward protecting your bones and preventing fractures. Building strong bones isn't just about genetics. It's about making intentional choices every day to support your skeletal health. Both diet and lifestyle play crucial roles in maintaining and even improving bone strength at any age. Nutrition is the foundation of healthy bones. Calcium is essential, as it forms the building blocks of your bone tissue. Adults typically need around 1,000 to 1,200 milligrams of calcium daily, depending on age and gender. Great sources include dairy products like milk, cheese, and yogurt as well as plant-based options like fortified almond milk, kale, broccoli, and tofu. Pairing calcium-rich foods with vitamin D is equally important, as it helps the body absorb calcium effectively. Sunlight exposure, fatty fish like salmon, and fortified foods are excellent sources of vitamin D. Beyond calcium and vitamin D, your diet should include other nutrients that support bone health. Magnesium, found in nuts, seeds, and whole grains, helps regulate calcium levels in the body. Vitamin K, present in leafy greens, is essential for bone metabolism. Protein is another critical component, as it provides the structure for bone tissue. However, it's important to strike a balance, as excessive protein combined with inadequate calcium intake can lead to bone loss. Physical activity is just as vital as nutrition. Weight-bearing exercises such as walking, dancing, or jogging help stimulate bone growth by placing stress on the bones. Strength training with resistance bands or weights also enhances bone density and builds muscle, which supports your skeletal system. For older adults or those at higher risk of fractures, low-impact exercises like yoga or tai chi improve balance and coordination, reducing the likelihood of falls. Avoiding harmful habits is equally important. Smoking weakens bones by reducing blood flow to the skeleton and interfering with bone-building cells. Excessive alcohol consumption has a similar negative impact, leading to decreased bone formation and increased fracture risk. Lifestyle changes should also include being mindful of overall health. Maintaining a healthy body weight is crucial, as being underweight increases the risk of fractures, while obesity places undue stress on joints and bones. Staying active, eating well, and addressing other health conditions can create a strong foundation for lifelong bone health. Understanding the state of your bone health is a vital step in preventing fractures and managing conditions like osteoporosis. Medical tests, particularly those designed to measure bone density, can help identify weaknesses early, allowing for targeted interventions before serious complications arise. The most common and reliable test is the dual energy X-ray absorptiometry, DEXA scan. This painless and quick procedure measures the mineral density of your bones, usually in areas prone to fractures, such as the hip, spine, and wrist. The results are provided as a T-score, which compares your bone density to that of a healthy young adult. A T-score of 1.0 or higher is considered normal, while scores between 1.0 and 2.5 indicate osteopenia, low bone mass, and scores lower than 2.5 suggest osteoporosis. Other tests that may be recommended include bone turnover markers, which assess the rate at which your body is breaking down and rebuilding bone tissue. These blood or urine tests can provide additional information about your risk for bone loss and the effectiveness of any treatments. In some cases, a quantitative ultrasound of the heel may be used as a preliminary screening tool, especially in situations where DEXA scans are not readily available. Medical tests are especially important for individuals at higher risk of bone fragility. If you are over the age of 50, have a family history of osteoporosis, or have experienced fractures from minor injuries, your doctor may recommend regular screenings. Postmenopausal women, in particular, are encouraged to undergo a bone density test, as hormonal changes during menopause significantly accelerate bone loss. Men with risk factors such as low testosterone or chronic illnesses should also consider these evaluations. In addition to identifying bone loss, these tests can help monitor the effectiveness of ongoing treatments. For instance, if you are taking medication to improve bone density, follow-up tests can show whether the treatment is working or if adjustments are needed. Early detection is critical because it allows for timely intervention, such as lifestyle changes, dietary improvements, or medical treatments to slow down or reverse bone loss. By staying proactive and informed about your bone health, you can significantly reduce the risk of fractures and maintain your independence and mobility for years to come. When it comes to preventing and managing fractures, advancements in medical science have provided a variety of effective treatment options. These therapies not only strengthen bones, but also help reduce the risk of future fractures, improving overall quality of life for those at risk. One of the primary approaches is medication designed to improve bone density. Bisphosphonates, such as alendronate and risdronate, are commonly prescribed to slow down bone resorption, the process where bone tissue is broken down and absorbed by the body. These drugs are typically taken orally or via injection and are particularly effective in individuals diagnosed with osteoporosis. Another category of medications is anabolic agents, like teriparatide and romosozumab. Unlike bisphosphonates, which prevent bone loss, these drugs actively stimulate bone formation, making them an excellent option for those with severe osteoporosis or multiple fractures. These treatments are often administered through daily or monthly injections depending on the specific medication. For postmenopausal women, hormone therapy can be an effective solution. Estrogen replacement helps slow down bone loss caused by the hormonal changes of menopause. However, because of potential risks, such as an increased likelihood of blood clots or certain cancers, hormone therapy is typically used selectively and under close medical supervision. Calcium and vitamin D supplementation remain essential components of any treatment plan, as they provide the nutrients necessary for bone health. Doctors often recommend combining these with medication for a comprehensive approach to treatment. Beyond medications, physical therapy and specialized exercise programs play a crucial role in managing fractures and preventing future injuries. Therapists focus on improving balance, strength, and flexibility to reduce the risk of falls. Weight bearing and resistance exercises can also help build and maintain bone density. In severe cases, particularly after a fracture, surgical interventions may be required. Procedures such as vertebroplasty or kyphoplasty can stabilize spinal fractures, while joint replacements may be necessary for hip or knee injuries. These surgeries aim to restore mobility and relieve pain, allowing individuals to return to their daily activities. For those already managing osteoporosis, fall prevention strategies are critical. This includes modifying the home environment, adding grab bars, improving lighting, and removing tripping hazards to minimize the risk of accidents. The key to effective treatment is personalization. By working closely with a healthcare provider, individuals can develop a tailored plan that addresses their specific needs, combining lifestyle adjustments, medication, and therapies to protect their bones and overall health.